So CT scans are a big part of the work that I do. For example, I just came from the Othopaedic clinic and saw a large number of people, and I probably ordered, I would say, maybe 8 CT scans out of probably 30 people or 40 people. So it's fairly common place for CT scans in my area of expertise. And some of those are planning, so the person's not very sick, but other times it's an emergency and you really, really need to know right away. So having access to CT scan is mission critical for the work that we do. The orthopedic surgeons at this hospital probably account for about 50% of the surgeries that we do. So even though there's only 6 of us, we do half the surgeries here, and a lot of those people will be worked up with a CT scan to get, ideal patient outcomes, and so it's vital.
Well, that's the beauty of technology. Things get better and better, and the fact that we can get a state-of-the-art CT scanner in Vernon is amazing. What happens with pediatric patients, which is my area of specialty, is that these are little bodies that are growing and changing, and we want to minimize the amount of radiation that children are exposed to whilst getting really great images and pictures. And so the amount of radiation that's needed is less. The scans are done faster. So that means then that it's less likely that we have to sedate our patients. It's less stressful on our patients, it's less stressful on the families, and we still get great images. As a physician, when you're worried about a serious illness in a patient and you can get the information that you need promptly in a very patient-centered way that is as easy as possible on the child and the family, that is huge. We can get the information we need and triage that care as quickly as possible and hopefully get the child back on the right path of treatment.
So in the emergency department, we use CT scanners every day, trauma care, emergency care, anyone that's coming in with a headache, abdominal pain, other complaints as well. Most of them end up with a CT scan. So having a second scanner would mean that you're getting those diagnoses quicker, so that means you're getting treatment faster. Having a second scanner would also mean that we didn't have to stop patients who were coming in as an outpatient to get that scan because there was an emergency patient that needed the scan first. So that means family doctors would also get diagnoses and treatment plans quicker, and patients in the community could get access to care faster.
Again, the second scanner is going to just open the door to many, many more treatments, new technology, decreased wait times for the community and in hospital, quicker access to timely treatment for patient presentations, take the workload off of all the units too, I think. I mean, emergency uses a CT scanner all the time, but the other floors hold patients. Delays to CT scans may delay discharges, may delay getting people back home, that type of thing. So a second CT scanner in the building certainly would be beneficial for that.